Hello everyone, welcome to Wellness Wednesday. Lindsey the pharmacist here, Wellness from D Consulting. This week's topic is bone health. And I picked bone health because it does come up a lot in consults. People will be taking calcium, vitamin D to support their bones, or they're taking vitamin D because they're tired, and that does help with your immune system and your fatigue. I've also just been doing some simple bone consults for mostly women, but some men too, who are going through menopause or manopause. So our bone health peaks in our 25s to 30s. That's when we have the most density for our bones. And then as we start to age, we have this slow decline. By 40, pretty much everyone is losing bone density. And you can get a scan done that will tell you where your bone density is and if you have osteopenia or osteoporosis. I actually have osteopenia at a very young age, and we're not really sure if that was because I swam so much, even though I did do exercise that was weight bearing, such as weightlifting. I did a lot of weightlifting. I did running before. Anyways, so 25 to 30 we peak. 40 we are all losing bone density. After 40, we go through a change called menopause for women with the hormone decline and manopause for men. So those supporting hormones help our bone density. And after that hormone drop, we see a rapid loss in bone density. So we see a higher risk for fractures. How do we slow down our bone loss? That is what we're talking about. Well, first of all, we want to make sure that you're doing the weight-bearing exercises, whether it's walking, whether it's strength training, whether it's lifting weights. If you need a program, let me know. I can get you some simple exercises to help with your bone density, climbing stairs, hiking, just get some impact onto those bones. Next, we want to make sure that you're eating lots of vegetables and protein. If you overeat too much protein, though, that will cause some leaching of calcium out of your bones. So try to keep it under, not excessive amounts of protein. I guess it would depend on the individual which amount of protein we would choose. And then the vegetables provide a lot of the nutrients we're going to talk about to help support your bone health. You can always get a vitamin D level done so we can see where you are. I don't like to just randomly toss out an amount of vitamin D for a person, as you can actually overdose on vitamin D. Calcium, though, we want to get 1,000 to 1,500 milligrams in our diet daily. And it's actually been shown if you spread that calcium out over your day, you absorb more of it than if you take it all at once. Okay, so we got our calcium. We have vitamin D also from the sunshine. It is a fat-soluble vitamin, so if you're going to take a supplement, you want to take that with some fatty food. Same with vitamin K. Vitamin K helps support your bone health, preferably the MK7 form. It is also fat-soluble, so you would want to take that with your vitamin D so that you get your fat solubles absorbed with the fatty food. Next up on the list is magnesium. Magnesium comes in some specific foods that are excellent to help with your bone health, but it also has so many other benefits like sleep, anxiety, gut health, that I typically just recommend a magnesium supplement. Then we have zinc. Zinc helps support our bone health, and so does phosphorus. You can get zinc from beef, spinach, shrimp. You can I'm going to post a list instead of just sitting here listing foods. And then last, we want to make sure you're getting plenty of omegas. Omegas come from fish, mainly fish and shrimp. So that is the calcium, vitamin D, magnesium, vitamin K, phosphorus, zinc, omegas. That is the support for your bone health, how to slow it down. If you are in or going through menopause or manopause, let's talk about hormone replacement therapy if you're a candidate for that. If you are not, we can also discuss a program for you to support your bone health. Okay, so let's see. We want to maintain a healthy, stable weight. We want to have our weight-bearing exercise. And we want to avoid really low calorie diets because then your body will start to use the nutrients in your bones, and we don't want that. I hope that you guys have a wonderful Wednesday and that you learned something about bone health. And if you need a recommendation on what to start for you, because again, everyone is a little different, I would be happy to help you. Thanks.